This young man first noted incoordination of the right foot at age 6 and subsequently developed progressive generalized dystonia. The first video segment was recorded at age 22 and the second at age 26. During the 4 years of follow-up, there was marked progression of his dystonia with development of scoliosis, retrocollis, and complete anarthria. How would you describe the voice problem?
Well, my throat hurts real bad down here, and then I get work out, and then I get my breath, I get choked with.
Okay, and then I understand about 15 years ago you started with a head shaking, is that right? Okay. What happens when you drink alcohol? Does the head shaking get better or worse?
It gets better.
This family has autosomal dominant dystonia, manifested chiefly. This 70-year-old woman began to lose the use of her right hand about 5 years earlier and later noted incoordination on the entire right side and more recently left side of the body. The findings of predominantly right-sided apraxia, graphesthesia, loss of partial reflexes, spontaneous and reflex myoclonus, as well as cervical dystonia are typical of cortical basal ganglionic degeneration. Task-specific dystonia manifested by flexion of some and extension of other fingers of the left hand while typing. This 33-year-old woman, adopted at age 6 weeks, developed torticollis at age 4.5 and subsequently underwent bilateral thalamotomy without significant improvement. This video segment shows severe generalized, predominantly right-sided dystonia interfering with her ambulation. This 38-year-old Ashkenazi Jewish man has a childhood-onset progressive generalized dystonia associated with coarse dystonic tremor in both arms. This 27-year-old man with schizophrenia treated with multiple neuroleptics developed severe cervical tardive dystonia about a year ago. This 62-year-old woman with Huntington disease has a 5-year history of chorea, progressive dysarthria, and dysphagia. Note the irregular gait. This man demonstrates palatal myoclonus secondary to a brainstem stroke. This 65-year-old man demonstrates post-anoxic action, postural, and kinetic myoclonus. Okay, reach out all the way. This 66-year-old woman with a 2-year history of progressive gait apraxia has marked start hesitation and right-sided apraxia consistent with a diagnosis of cortical basal ganglionic degeneration.
Straight in front of you, real straight.
This 18-year-old woman first noted shuddering spells at age 10, which evolved into oscillatory myoclonus.
Elbows extended. There you go, just like that. Close your eyes. Okay. I'd like you to stand up now. Just stand there for a minute.
How old are you?
61.
And what bothers you the most?
Well, basically the movement itself, and most painful or most uncomfortable is that it would tighten up and bind my feet. But at first it was the long periods of movement that I would have that bothered me so much.
This 61-year-old man has a 6-year history of restless legs, most severe in the evening. During daytime, he is troubled by leg stereotypies.
I understand you like to play with Hot Wheels cars.
Johnny,
Oh yeah, what else do you like to do?
Johnny, this that.
You like to ride your bike?
Johnny, bye-bye.
Uh-huh.
Say bye-bye for bye-bye.
Okay.
This 32-year-old man with a history of perinatal injury, mental retardation, and obsessive-compulsive disorder had an exacerbation of stereotypic movements after exposure to haloperidol. The patient exhibits stereotypies typically seen in patients with.
This 76-year-old woman presented with a 12-year history of progressive Parkinson's disease, manifested by a large amplitude rest tremor, marked bradykinesia, and difficulty initiating gait.
This 60-year-old woman has a 5-year history of rapidly progressive Parkinsonism and marked distal deformities. Because of the rapidly progressive course, the stridal hand and feet deformities, and gradual emergence of urinary incontinence and orthostatic hypotension, she will likely evolve into an atypical Parkinsonian syndrome, such as the stridal neurodegeneration type of multiple system atrophy.
Can you tell us when you first had problems with Parkinson's disease?
This 66-year-old woman shows severe levodopa-induced peak-dose chorionic dyskinesia. In addition, not shown here, she has painful end-of-dose dystonia.
Several years before it was diagnosed as Parkinson's.
Okay. When did you start taking Cinnamon?
I began taking cinnamon 8 years ago.
Okay. And when did you first notice dyskinesias?
Now then I'm not so certain because it kind of began gradually.
Okay, turn around. Okay, turn around.
This 19-year-old man with prior history of Tourette syndrome was treated with metoclopramide after general anesthesia for dental surgery. This was followed within a few days by the development of This 64-year-old woman has a 7-year history of emotional incontinence, hypophonia, and progressive loss of balance, which resulted in a fall and a fracture of the right arm. She has vertical ophthalmoplegia, which can be overcome by an oculocephalic maneuver, as well as apraxia of eyelid opening and broad-based unsteady gait. These findings are typical of progressive supranuclear palsy.
And open them. Open it.